Bariatric surgery has been particularly noted to be effective against diabetes. In the United States currently, over 70% of type 2 diabetes is associated with excessive weight. Type 2 diabetes used to be called adult onset diabetes. It's no longer known as adult onset diabetes because there are 7 to 10-year-old kids who are 300 and 400 pounds. Those children are diabetic already, and if not treated and if their diabetes is not brought under control, they may be dead by the time they're 20 to 25 related to the consequences of their diabetes. Blindness, amputation, heart attacks, kidney failure, all are consequences of diabetes over the long term. Diabetes in the United States is epidemic. In fact, worldwide it's epidemic. Obesity is not just a United States problem, it's an international problem. Diabetes is intimately associated, and currently there is no medicine which will make your diabetes go away. The medicines that you have will control your diabetes and bring your sugar into a safe, normal line if they're well managed by your physicians to be able to get you there. But almost all patients start on a single medication, they go to a second medication or a third medication, and then on to insulin. It's a progression, and over time, day after day, when your blood glucose is not normal, it begins to have its tissue-based effects on your eyes, on your circulatory system, on your heart, on your kidneys, and on all your other organs. Surgeons who do bariatric surgery understand the relationship between diabetes and bariatric surgery. And bariatric surgery has been found to be the only thing which will stop your diabetes in its tracks and reverse it. Even if that happens for a period of time, which is temporary, it still gives you the benefit of not having that day-to-day pounding on your eyes, on your circulatory system, on your heart, on your organs, and on your kidneys. We believe that it's the appropriate way to go, and there's much clinical data to support that. There are peer-reviewed journals comparing maximal medical therapy to surgical therapies, including band, bypass, and sleeve surgery. And in each case, band, bypass, and sleeve surgery is more effective in bringing difficult to control diabetes into line or completely eliminating diabetes. That may be a temporary situation. In some cases, it lasts 5 years, and then the diabetes begins to come back. It doesn't come back as strongly as it did prior to surgery, but it's very clear. As the weight comes down, the insulin resistance goes away, and people benefit dramatically, and in many cases, no longer need medication to control their blood glucose, and they have normal numbers and no longer suffer the effects of the tissue effects of the diabetes.